Hey there! So what are your options for estrogen therapy? So generally speaking, there's going to be a couple of different kinds. I'm going to go over their names, how you take them, what the general costs are with them, maybe a couple of pros and cons along the way. We're also going to talk briefly about progesterone and testosterone blockers as well. So let's jump on in. The very first thing we'll talk about is estrogen pills. That's the one that most people are pretty familiar with. Most people know how to take pills. We're generally going to have you put them under your tongue briefly before then swallowing whatever's left after a couple of minutes. This is due to how much more you will absorb medication-wise from the pill whenever you do this. That is optional. You don't have to do that. We just do advise it because you can absorb up to 30% more of the actual hormone from that medication if you do that first. Anyway, so pills, pretty easy. They're going to cost anywhere from like $10 to $20 a month usually at your local pharmacy. So pretty affordable, pretty easy to take. Some people get kind of annoyed with them though because you do generally have to take them multiple times a day, so it's not like you just get up, take one, boom, you're done, unless you're doing maybe non-binary dosing or something like that. But in general, for full feminization, we're going to be prescribing them to be taken 3 times a day or so. It doesn't have to be perfect, but some people get kind of tired of that after a while and want to switch to something else. So moving along, next topic is patches. So estrogen patches are okay for some individuals. Generally speaking, it's a patch. You put it on, it stays on either for 1 week or for 3.5 days, like twice weekly. You change it out. It depends. Usually we're going to prescribe the twice weekly patch just because it's a little bit easier to keep the sticky working whenever you're changing it out twice a week as opposed to once a week. And that's part of the con to the patches, is keeping them stuck on can be kind of annoying. Some people it will annoy or irritate their skin. Some people just don't absorb them very well. So these are things to keep in mind. You know, patches can be okay in some individuals, but in general, you know, keeping them stuck on can be a problem, especially in a state where, like in Mississippi, where it's humid and rains a lot. That could be kind of a problem. Also depends on what job you have. If you have a sweaty job, it might not really be that great. You'd be sweating your patches off. So anyways, so generally speaking, they go on a couple of days or once a week. The general cost is going to run somewhere around about $40 a month for patches. And so they're reasonably affordable, but certainly a little bit more costly than, say, the tablets, the pills are. Moving right along, the next one is going to be injections. So injections are a good choice. I'm biased. I like injections just because they're boom, done. You don't have to worry about it for the rest of the week. In general, we will prescribe an injection to be done once weekly. That can be adjusted depending on the person's levels and how they're handling it and everything, but just for generalizing, we're going to say they're done once a week. Cost-wise, they run, it really, like, it can run the gamut. Anywhere from $70 to $120 for a vial. That vial is going to last about 90 days or so. Again, it depends on the dose and the frequency that we have you taking it, but about 3 months worth supply is $70 to $120, depending on the pharmacy you go to, depending on the region you're in. Lots of different factors, but that's about the average price we see. Like I said, I do like injections because you give it, you know, once a week and you're done. You don't have to remember it every single day or multiple times a day or, you know, a couple times a week, which is kind of a weird thing. So they can be pretty handy there. And they do get your levels up and, you know, right where they need to be. There's no worrying about, am I absorbing it appropriately or anything like with patches could be, and sometimes pills. So, you know, injections, I'm a big fan, but some people not so much because they don't want to have to stick themselves. So that is something to keep in mind. You know, you gotta give it in an injection, so Anyway, one last thing I'll mention on here is estradiol cream. This is not something that's going to be available from just a general pharmacy like your local CVS, Walgreens, or whatever. This is going to be something that you have to have compounded at a specialty pharmacy. So a little bit of an extra step there and usually an extra cost associated with it. Generally speaking, it's going to run somewhere around $70, $80, $90 a month for estradiol cream. So keep these things in mind whenever you're thinking about what type of estradiol might be, you know, appropriate for you. Is also affordability, as well as can I do it? You know, can I stick myself, or would I rather take a tablet, or would I rather apply something topical like a cream? Creams are usually going to be applied once daily. Every now and then they'll need to be applied twice daily. It kind of depends on you and how you process that hormone in your body and everything. So generally speaking, once a day for the cream, the topical. So those are the kinds of estradiol and everything that are included in feminizing therapy. Sure, there are others out there in the world. A lot of them are not available here in America, or what are you gonna do? And anyway, so we're gonna move on from there and go into progesterone. Just briefly mentioning progesterone because I have a whole video too actually dedicated to it. And so whenever you hear progesterone, you probably see it around online. A lot of people like to tout it as if it's some kind of a magic pill that's going to instantly produce breast development or better your libido or something like that. It is most definitely not those things. So please be aware that there is nothing out there that's a magic pill that's going to instantly boom feminize overnight or in any capacity that's going to be considered fast. So whenever you hear people saying that, that is a myth. But by and large, progesterone is something that we tend to prescribe more after the first 1 to 2 years of HRT, because at that point, that's when you will already have the building blocks laid down tissue-wise from the estradiol you've been taking, so that then when progesterone comes in, it has something to work with, because progesterone is one of those kind of things that if you take it before you need it, it's really doing nothing but spending money. So anyway, and then there's a lot of problematic things that can happen with progesterone, such as it converting into androgens or masculine hormones. Again, these things are discussed in my separate video if you want to go find that. But generally speaking, progesterone isn't prescribed right off the bat. It's usually something we wait to prescribe. And then next topic, moving on to testosterone blockers. So a lot of people hear about testosterone blockers. They don't really know a whole lot about why people keep throwing them out there, when, here's the secret, they're not really needed in most cases. It's actually considered old practice to have to prescribe testosterone blockers right off the bat for someone doing full transition, that is. I should clarify that. If you're doing more of an androgynous or non-binary, sometimes there can be a mix of things in there where these would be a little more handy to use. But as far as using it for full feminization, really not necessary. I discussed this also in another couple of videos, but essentially what you're going to be doing is, when we prescribe you this estradiol, we're going to be prescribing it at a dose that is significant enough to suppress your body's own production of testosterone. And this is done through the hypothalamus and pituitary gland getting feedback from the estrogen levels in the body and yada yada. Like I said, if you want to hear more about that, go check out my other videos. But anyway, we usually will start off with this, and so we'll start you off on what we call solo estrogen therapy, meaning estrogen alone, and no combination of testosterone blockers or anything else. And then we're going to check your labs and see where they're at after a certain point. Now, if they're at, your testosterone level hasn't come down quite to where we need it, and we can just increase the estrogen dose and get it there, boom, we're good. If it looks like, though, that you're going to be one of those maybe 2, 3, 4% of people who actually does require a testosterone blocker to get your T levels down, that's fine. At that point in time, we will go ahead and prescribe them. But by and large, they are unnecessary for full feminization therapy. But like I said, that's something that I cover again in another video, and you can ask your provider more about it whenever you see them if you're still kind of curious and like, what on earth are they talking about, these hypothalamus and everything. Anyways, so just be aware there are other medications out there that can be used for feminizing therapy other than just estrogens. In general, they either are unnecessary or they may be something that get added along the way and not necessarily up front. But anywho, so that is your feminizing therapy medication options. Hope you write down some questions there to ask your provider so that you don't miss out on anything. Of course, you can always rewatch this and bore yourself to tears though. Anyways, y'all have a fun day, and we'll see you later. Bye.